Self-harm and suicide in borderline personality disorder, BPD, suicide prevention and support strategies. Borderline personality disorder, BPD, is a complex mental health condition characterized by intense emotional instability, impulsivity, and relationship challenges. One of the most distressing aspects of BPD is the prevalence of self-harm and suicidal thoughts, with many individuals with the disorder engaging in self-destructive behaviors as a way to cope with overwhelming emotions. These behaviors are often linked to feelings of emptiness, fear of abandonment, and emotional dysregulation, which can lead individuals with BPD to believe that suicide is the only way to escape their emotional pain. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore suicide prevention and support strategies for individuals with BPD who are at risk of self-harm or suicide. Understanding the underlying causes of suicidal thoughts and behaviors in BPD, as well as offering compassionate support and practical prevention strategies, can make a significant difference in the lives of those struggling with the disorder. 1. Understanding the connection between BPD and suicidal thoughts. Suicidal thoughts and self-harm in BPD are often triggered by overwhelming emotional pain, feelings of rejection, and the fear of abandonment. Individuals with BPD may experience rapid shifts in their mood, which can lead to emotional crises and feelings of hopelessness. For many, suicide or self-harm becomes a way of regulating emotions or temporarily ending their pain, even if it is not truly a desire to die. It is often more about escaping overwhelming feelings or trying to regain a sense of control over their emotional world. 1.1 Emotional dysregulation and suicidal thoughts. The hallmark feature of BPD is emotional dysregulation, where individuals experience intense emotional reactions that are out of proportion to the situation. This can lead to feelings of despair, helplessness, and hopelessness, which may manifest as suicidal ideation or self-harm. Example: a minor relationship issue may trigger an intense emotional crisis in someone with BPD, leading them to feel like they cannot cope with the situation and resort to self-harm or contemplate suicide as a way to escape the pain. Key fact: emotional dysregulation is one of the core causes of suicidal thoughts and self-harming behaviors in BPD. Learning to manage emotions is critical in preventing these self-destructive behaviors. 1.2 Fear of abandonment and self-destructive behaviors. Fear of abandonment is another central feature of BPD. When individuals with BPD feel rejected or abandoned, whether real or perceived, they may feel an overwhelming sense of emptiness, worthlessness, and disconnection, which can lead to suicidal thoughts as a way of managing or ending that pain. Example: an individual with BPD may feel abandoned when a friend cancels plans or does not respond to a text message. This may trigger feelings of rejection and lead to self-harm or even thoughts of suicide as a way to cope with the intense emotions that follow. Key fact: fear of abandonment can be a powerful trigger for self-destructive behaviors in BPD, and addressing this fear in therapy is key to reducing suicidal ideation. 2. Suicide prevention strategies for BPD. Prevention of suicide and self-harm in individuals with BPD is an ongoing process that involves therapeutic intervention, support systems, and practical coping strategies. The goal of suicide prevention is not only to reduce the risk of self-destructive behaviors but also to help individuals with BPD develop healthier ways of coping with emotional pain. 2.1 Therapeutic approaches. Dialectical behavior therapy, DBT. Dialectical behavior therapy, DBT, is the gold standard for treating BPD, particularly in addressing self-harm and suicidal behaviors. DBT focuses on teaching individuals how to manage intense emotions, cope with distress, and improve interpersonal relationships. Key components of DBT for suicide prevention. Emotion regulation, teaching individuals how to identify and manage intense emotions without resorting to self-destructive behaviors. Distress tolerance, helping individuals build resilience and learn skills to handle emotional crises without engaging in harmful behaviors. Mindfulness, helping individuals become more aware of their emotions and thoughts in the present moment, so they can intervene before a crisis escalates. Interpersonal effectiveness, teaching individuals to communicate effectively and manage relationships in a way that reduces conflict and feelings of abandonment. Key fact: DBT has been shown to significantly reduce suicidal ideation and self-harm in individuals with BPD by teaching them essential skills for emotional regulation and coping. 2.2 Cognitive Behavioral Therapy, CBT. Cognitive Behavioral Therapy, CBT, helps individuals with BPD recognize and challenge negative thought patterns that contribute to self-destructive behavior. By changing distorted thinking, individuals can begin to reframe their emotional experiences and reduce the intensity of suicidal thoughts. Key components of CBT for suicide prevention. Cognitive restructuring, helping individuals identify and challenge negative thoughts that fuel emotional distress. Behavioral activation, encouraging individuals to engage in positive activities that can improve mood and reduce emotional suffering. Problem-solving skills, teaching individuals how to manage stressors and difficult situations without resorting to self-harm. Key fact: CBT can help individuals with BPD reframe their perception of emotional situations and develop healthier coping mechanisms for managing emotional pain. 2.3 Crisis Management and Safety Plans. A safety plan is a personalized tool that individuals with BPD can use during a crisis to avoid self-harm or suicidal behavior. The plan outlines specific steps to take when the individual feels overwhelmed, such as calling a therapist, reaching out to a friend or family member, or engaging in grounding techniques. Key elements of a safety plan. Warning signs, recognizing when emotions are escalating and identifying early signs of a crisis. Coping strategies, listing activities or behaviors that can help manage emotional distress, such as breathing exercises, distraction techniques, or self-soothing practices. Emergency contacts, having a list of trusted people, family members, therapists, or crisis hotlines, to contact during a crisis. Professional support, having access to a mental health professional who can provide immediate support when necessary. Key fact: safety plans provide individuals with BPD a practical framework for managing emotional crises in a healthy way, which can significantly reduce the risk of self-harm and suicide. 2.4 Medication for co-occurring conditions. Medication may be used to address comorbid conditions, such as anxiety, depression, or mood instability, which often contribute to suicidal thoughts in individuals with BPD. While medication alone is not sufficient to treat BPD, it can be an important part of a comprehensive treatment plan when combined with therapy. Key fact: medications such as antidepressants, mood stabilizers, or antipsychotics may be prescribed to help manage mood fluctuations and reduce emotional instability, which can decrease the intensity of suicidal thoughts. 3. Support systems and the role of loved ones. While professional therapy is critical for managing BPD, support systems, such as family, friends, and support groups, play an essential role in suicide prevention. Family members and friends can provide emotional validation, stability, and encouragement for individuals with BPD. 3.1 Encouraging open communication. Family and friends should encourage open communication about suicidal thoughts and self-harming behaviors. If someone with BPD expresses thoughts of suicide, it is essential that loved ones respond with empathy, non-judgment, and validation of the individual's feelings. Key fact: open communication can reduce the feelings of isolation and shame that often accompany suicidal ideation, creating a safer environment where the individual feels supported and understood. 3.2 Providing emotional support. The fear of abandonment is often a key trigger for suicidal thoughts in BPD. By providing consistent emotional support and reassurance, loved ones can help alleviate feelings of rejection and helplessness that may lead to self-destructive behavior. Key fact: validation and emotional presence are critical to helping individuals with BPD feel secure, reducing the risk of suicide attempts and emotional crises. 3.3 Seeking support for loved ones. Supporting someone with BPD can be emotionally taxing, and it's important that family members and friends also seek support for themselves. Support groups or therapy for family members of individuals with BPD can provide strategies for self-care, coping with emotional strain, and learning how to best support their loved one. Key fact: support for caregivers is essential, as it helps them maintain their own well-being while providing consistent support for the individual with BPD. 4. Conclusion. Suicide prevention in borderline personality disorder, BPD, is an ongoing process that requires a multifaceted approach. By utilizing evidence-based therapies such as dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, creating a safety plan, providing emotional support, and offering medication for co-occurring conditions, individuals with BPD can learn to manage their emotions, reduce impulsivity, and prevent self-harm or suicidal behavior. Support from family, friends, and mental health professionals is vital in creating a stable, compassionate environment that encourages healing. With the right strategies in place, individuals with BPD can overcome the urge to self-harm and find healthier ways to cope with emotional pain. In future episodes, we will continue to explore how to support individuals with BPD, reduce the risk of suicidal ideation, and create a therapeutic environment for long-term healing. Stay tuned for more insights on borderline personality disorder, BPD, and the path to recovery.